Ontario's lockdown to slow the spread of COVID-19 has ended. Here in the Northwest, we entered the red or control category yesterday, but the number of people testing positive for the virus in the region is still increasing by double digits nearly every day. Outbreaks are continuing in correctional facilities in Thunder Bay, as well as among the vulnerable and homeless populations, and at one school. To help us get a sense of what's going on, we've reached Dr. Janet DeMille. She is the Medical Officer of Health for the Thunder Bay District Health Unit. Dr. DeMille, good morning, and thanks for joining us again.
Good morning, Amy.
So as I said, Thunder Bay is in the red category at this time, although we continue to see a significant number of new cases. How comfortable are you with that red category at this point?
You know what, I think it's reasonable for us to have gone into red at this time. It's always based on our numbers over the previous couple of weeks and where the cases, what we're seeing happening and who's impacted. And, the red category still has significant limitations on facilities that are sort of allowed to reopen and on gathering limits such things. And I think if all of those are put in place, then there are certain things that we can do and that we can do it safely. I think perhaps what concerns me most is not being necessarily in red, right now, but what is going to happen over the next couple of weeks and even over the next month. And that's sort of in our area as well as more broadly in Ontario. And, how that might influence not only our case numbers, but obviously where we go in terms of that framework.
And what concerns you about what might happen over that next month?
Well, when you look, provincially, I guess, it relates to these variants of the COVID-19 virus, the variants of concerns, or VOCs that they're called. And, recent modeling done provincially shows that, in the month of, even in February and the month of March, we might see a very significant increase in those variants. And we know those variants are concerning because they spread more easily. They might have a shorter incubation period. People get sick faster, and they spread more. And they actually could be driving, it could drive a significant increase in COVID-19 cases in the province. And certainly that could impact us here. And there's a lot that we know about those VOCs, but there's a lot that we don't know.
Mm-hmm. And for you here in Thunder Bay, trying to keep things under control and hoping those variants don't take hold, is there much more you can do at this point?
Well, so right now, we do, there's a number of public health measures specifically related to cases and contacts and management of people who could have COVID that we're implementing. That guidance has been updated even as soon as the last couple of days, that it really strengthens what we do and how we're going to manage people who have COVID and people who may have been exposed to COVID. And we're in the process of implementing that. So it really means, maybe some more people might have to be in isolation if they're deemed to be high-risk contacts, a lower threshold for deeming somebody at high risk, greater testing potentially around especially certain circumstances. And we'll see that sort of unfold over the next few days and few weeks. Okay,
so in a way things will be ramping up, I guess, in terms of measures.
Yeah, I mean, from the point of how we manage somebody who has COVID and somebody who might be exposed to COVID, especially, just in case that person that could be a variant of concern, and therefore strengthening what we do with those individuals compared to what we currently do.
I want to ask you about a number of schools that have been reporting cases in the last couple of weeks. There has been quite a few. Yep. What are your thoughts on what's going on there? Is it a sign that outbreaks are having a broader impact, that the virus is spreading more in the community, or is it just a coincidence? Why do you think we might be seeing more reports from schools?
Well, basically, obviously, we're seeing kids or staff, anybody in the school setting, get COVID. And a lot of that, and what we see, if I could just speak around the students, what we see is that it's often that they've acquired it outside of the school setting. And they're usually because they've been in contact with somebody who has COVID. So that happens within families. So if somebody, if a parent gets COVID, then that could expose the kids. That does expose the kids if they're living together, and then you could see those kids getting COVID. And if they have been in the school setting, of course, the kids would be deemed high-risk contact, and if they would isolate. But if they do get COVID in the days, leading up to that diagnosis, if they've been in a school setting, then that means the school is potentially exposed. So what we're seeing is kids and others, adults in a school setting, being exposed in the community, often in their households, or through other activities that they're doing, and potentially exposing the schools. But we don't still have much evidence of actually spread in the schools. So there's a lot of measures that the schools and school boards have put in place to really protect against any spread in the school setting. I think we have that. We've shown evidence of that in one school here in Thunder Bay, but the rest of them, so far, we don't have evidence of spread.
Mm-hmm. But what does it say about the spread in the broader community, though?
Well, it means that, we're seeing cases in individuals who are parents where, it's often linked to the number of cases that we have. We're seeing, in some of our cases that, COVID spreads within households, so we're seeing households impacted. If there's a lot of people living in that household, that's sort of contributing to, a higher case number if all of those individuals get COVID. And we've also seen a little bit of gathering, people, kids maybe gathering together and potentially spreading the COVID outside of the school.
One of the biggest concerns in recent weeks has been the outbreak among the city's vulnerable and homeless population. Can you tell me the latest in terms of that outbreak?
So it's very much an active outbreak, unfortunately. So we are following up with people. We're doing a lot more testing. There's a strong partnership of key stakeholders, and we're doing a lot more testing. We're actually out there looking for cases and finding them. We do follow up with individuals. We follow up with the people who are that they might have been in contact with. Again, people in the same household or people that they're interacting with. We follow up. So we're still diagnosing COVID-19 in people in that particular population and those that they're connected to. So we're working very closely. Like there's an isolation shelter to manage individuals that their people are supported. They can stay there if they get COVID. They could stay there throughout the course of their illness, and they're supported during that, as well as individuals who are high-risk contacts are also can go to the isolation shelter, and that center has been recently expanded, and the staffing resources to be able to support that.
Are you able to give me a sense of the scale of that outbreak among the vulnerable and homeless population? When the outbreak was declared, it was that there was a small number. Is it still a small number? How much has it grown?
You know what? It's hard to measure exactly the number because it's hard to sort of define that population. And then what we see, is there could be an individual who maybe has no fixed address or does couch surfing, kind of stays, for a couple of weeks in one spot and then moves on. And they might be staying with, for example, family members. And then they spread it to that family member or the other people in the household. And so what we're seeing some of that spread, but we don't necessarily include that those individuals would be considered close contacts. So it is a fairly significant proportion of our numbers. Maybe I would say the individuals who are directly impacted and then the household spread of where they are, maybe 50% of the numbers that we're reporting these days.
I know a lot of work went into expanding the isolation shelter, and you also issued an order to require people released from the jail to go there. Is it still a challenge to find people and convince them to stay at the shelter to isolate?
Yeah, there's a number. First of all, I think that approach and our work with corrections is people are being, are showing up at that isolation shelter, and we can do that assessment. And not everybody will need to stay there, but that's It is a challenge. We follow up with individuals. It is, a challenge to help individuals stay in isolation, and there's certainly a lot of supports provided for them. That is, working in many situations. And then we connect with them. We get information. We're very much working with our partners, so it's not only us that's out there looking for people, but other, some of our partners may find an individual that we're looking for, and then we can follow up or work through that partner to be able to get the information we need and provide that individual the support.
Are still more resources needed for that isolation shelter to keep it running as you'd like?
Well, you know what? I think we need to be prepared. We are quite stretched in terms of that center, but there's a lot of work that's going on every day, with our partners, with the City of Thunder Bay, with the DSAB, with St. Joe's, really working together. We have connections with the province as well. The province is paying attention and supporting. Red Cross and others are coming into play to be able to basically meet the needs that we have at this time.
Dr. DeMille, we began by talking about the fact that restrictions are loosening in Thunder Bay to the extent that we're in red. As things begin to reopen somewhat, what do you want people to keep in mind and be thinking about?
You know what? It's all those basic measures, and especially as we talked about the variants of concern, right? If you have any symptoms, stay at home, arrange to get tested. We have, we have good access to testing, and stay at home until you get that test result back. Remember that it spreads when we're interacting with other people. So all of those measures, so we reduce the number of interactions that you have. Even when we're opening up a little bit, keep your interactions to just the people in your household. If you are going to work, like you're essential worker, be very mindful of policies so that the virus doesn't spread in the work setting. We all know what to do, right? Stay home when you're sick. Screen yourself, get tested, stay, wear a mask, be 2 meters apart, be isolated, and don't gather. Don't have people over to your home, even for that 15 minutes, little interaction. That's what spreads. Connect with people electronically or by phone. We need to hang in there. It's mid-February. I still remember the summer we had last year, and that's coming. And the vaccine is also coming. So just encouraging people to be very mindful of all those measures that we can all take.
Dr. DeMille, really appreciate your time this morning. Thanks so much for joining us.
Thank you.
Dr. Janet DeMille is the Medical Officer of Health for the Thunder Bay District Health Unit.